Adverse life experiences during developmental periods can have a profound impact on physical and mental health in adulthood. Challenges faced by children that may have once been viewed as harmless are increasingly understood as being capable of influencing health in later life. This saying, "What doesn't kill you makes you stronger," is certainly not always the case. The widely accepted adverse childhood experience measure includes the categories of child maltreatment, which includes emotional, physical, and sexual abuse, as well as emotional and physical neglect, and household dysfunction, which includes parental separation or divorce, mother being treated violently, household substance abuse, household mental illness, and incarcerated household member. Other forms of adversity that have been added to ACE measures include bullying, community violence, discrimination, poverty, medical trauma, and several other exposures that can occur in the community. In North America, 1 in 4 people have experienced at least one ACE. Prolonged exposure to ACEs can create a toxic stress response, which can damage the developing brain and body of children and cause long-term health problems. While many individuals exposed to ACEs can be resilient, for others it has been suggested that time does not heal all wounds. Some people develop post-traumatic stress disorder after ACEs and others do not. Many people blur out the memories of these experiences and unintentionally downplay the impact on their life, and some become entirely amnestic, not even recalling events at certain times. The differences depend on individual factors such as genotype, as well as the type of ACE that was experienced. It has been shown that the dimension of childhood maltreatment, which includes physical or sexual abuse, has a stronger impact on mental health than household dysfunction, for example, parental drug use or divorce. Associations of multiple ACEs have been determined as weak or modest for diabetes and overweight and obesity, moderate for smoking, heavy alcohol use, heart disease, cancer, and respiratory disease, strong for sexual risk-taking, problematic alcohol use, and mental ill health, and the strongest for problematic drug use and interpersonal and self-directed violence. ACEs represent profound societal burden globally, which is particularly concerning given that many of these exposures can be prevented. Traumatic experiences during adulthood can also be quite damaging to health. For example, trauma and adversity of any kind can lead to an unhealthy relationship with food, compromised nutritional status, and various forms of disordered eating. The relationship between food, individuals, families, and communities must be treated with a compassionate and holistic perspective that acknowledges individual, historical, and systemic trauma. This perspective has been referred to as the social determinants of health and is used as the predominant conceptual approach in public health. Adverse food-related experiences can include unreliable and unpredictable meals, restriction or control over food, as well as body shaming, sometimes imposed by parents or family members, a loss of food traditions, and manipulation, punishment, or rewarding with food, which is again sometimes done by well-intentioned caregivers. Dietary behaviors that result from adversity include binge-like eating disorders and reliance on convenience foods, often high in sugar, salt, and fat, which is many times referred to as food addiction. These behaviors can include hoarding food, impulsive decision-making, and a deprioritization of planning as well as budgeting. Trauma-informed nutrition therapy acknowledges the roles that ACEs and other forms of adversity play in a person's life. It recognizes symptoms of trauma and promotes resilience by not exacerbating these hidden wounds. A trauma-informed approach is characterized by an understanding that unhealthy dietary habits, chronic disease, and poor health outcomes may be a result of adverse experiences and not necessarily a result of individual choices. Therefore, trauma-informed nutrition aims to avoid shaming, blaming, and stigmatization. Trauma-informed approaches focus on holistic well-being rather than weight and BMI, and recognize that some nutrition interventions can be triggering for some people. Our approach acknowledges the strengths and skills of clients rather than pointing to a lack of willingness, and we inspire healing and a personalized relationship to food. Additionally, trauma-informed nutrition therapy is a practice of cultural humility which aims to address both conscious and subconscious biases. At Wise Mind Nutrition, we are proud to be on the front line of providing a trauma-informed approach to nutrition-related behavior change. In fact, we believe this is the future. We invite you to explore this topic with us and add to the conversation.